The July 2015 issue of CardioSource World News was on destination therapy. Where are we going exactly? So in the December 15th issue of JACC, consider this an update to that cover story. The main paper is on multi-center study evaluation of a fully magnetically levitated left ventricular assist system for the treatment of advanced heart failure. And we're talking here with the writer of the editorial comment, Dr. Nir Uriel, MD, and this is, are we at the precipice of a disruptive innovation? You're an associate professor of medicine and the director of the Heart Failure, Transplant, and Mechanical Circulatory Support at the University of Chicago Medical Center. This is really what you're commenting on is the first in human experience of a new durable LVAD. It's the HeartMate 3.
Yes.
So first off, fully magnetically levitated LVADs. Tell me about this system,
So this
the
is
next generation.
The next generation, I think that we are in a period of time that we are very fortunate to see the evolution of technology in order to reach the phase that we will be able to support our patient. And every generation of the mechanical circulatory support is going for the next level. The HeartMate 3 contains a special technology that is fully magnetic levitated. There is a body that creates a magnetic field. Inside this body, there is a motor. This motor is going to rotate in a speed between 4,000, 6,000, 8,000, 10,000 revolutions per minute. By doing that, he doesn't have any bearing. And the reason that he doesn't have any bearing is because there is a magnetic field. This is the magnetic levitated. But not only that, it doesn't have also a mechanism that depends on the hydraulic power as the previous generation devices. So it's the only device currently in the durable device technology that contain a magnetic field that makes sure that we will not have bearing. Why it's so important to not have bearing? And that may be the key. So let's go one generation below the HeartMate 2. That is a great pump by itself. However, it is contained bearing. There is an axial flow pump, and there is a motor that rotates in a speed of 8,000 to 12,000 revolutions per minute, and there is bearing that hold it. By having those bearings, you create heat. By creating heat, there is a chance that there will be a process of denaturated protein. Those denaturated protein that can create eventually a turbulence of flow and be a cause of device thrombosis. One of the features that we need to see in the next generation of devices was to eliminate those bearings in order not to create those heat and maybe reduce the risk of device thrombosis. The HeartMate 3 is the next jump in that regard.
So the HeartMate 3 next-gen device data, what did they find?
So this is actually very fascinating. This is a very small study that was done in Europe, Australia, and Canada. So this is a multi-center, multi-continent study, and this is a big advantage. However, the number of patients that were studying this was only 50 patients. So we have to take whatever I'm going to take now only in a study of 50 patients. In that, what the main finding of the study is, first of all, what is the survival of the patient in the first 6 months after the device implantation? And they were phenomenal. We can see a 1 month survival of 97% and a 6 month survival of 92%. This is something that is unique to those device technology, to already speaking about something above the 90% when we're speaking about the sickest patient that we can treat in cardiology, patient that are in advanced heart failure. The second part of the study was looking about, okay, we can survive those patients. What is the quality of life that we give them? And what is the adverse event that relate to that? So let's start with the quality of life. There was a significant improvement of the quality of life. How we measure them? By 2 parameters. One is how much, very simple, how much people can walk. 6-minute walk, and of course, the quality of life is assessed by questionnaire that we give in assessing Kansas City, for example, questionnaire to assess the quality of life. Both improved dramatically. In the NIA class, New York Heart Association class of the patient prior to device implantation was always 3B or 4. And after device implantation, 82% of the patient moved to New York Heart Association class 1 and 2. It's dramatic improvement in the New York Heart Association class, meaning they can walk. If they can walk, they have a better quality of life. Right. And that we saw also in the reduction of the score in the questionnaire that the author provide. The second phase is, okay, so what is the adverse event? Because there is no mechanical circulatory supports yet in the market without any adverse event. And here I want to really go back deep to understand this is 50 patients. So we need to remember that. Right. And in those 50 patients, we saw a tendency to reduce the frequency of bleeding compared to other study, but this is too small and too short in order to know it for the long term run. There was an intermediate rate of strokes, both ischemic and hemorrhagic, 8% and 4%. That is 12% in cumulative. That is maybe a little bit higher than what we know from the HeartMate 2, maybe a little bit lower from what we know from the endurance study in relate to the age. But again, here it's too early and we need to wait a little bit. However, the key element that people ask, we started with magnetic levitated, we don't want to see device thrombosis. There was 0 device thrombosis among those patients. There was 0 pump failure among those patients. So maybe this technology really do what it's supposed to do in regard to that. Again, with a grain of salt. We will have the answer to all of those in a bigger study that's called the Momentum 3. The Momentum 3 is the parallel study to check HeartMate 3 in the United States. There is 60 sites, and there is going to be 1,028 patients that is going to be randomly assigned. It's not a single arm, randomly assigned to get HeartMate 3 compared to the HeartMate 2. There is going to be a short cohort that we follow for 6 months. There is going to be a long cohort that we will follow for 2 years. And of course, there is going to be endpoint that relate to this concept of hemocompatibility. So definitely, this is something that it's a very nice to us to know while we're doing this American study on 1,000 patients, that there was no device thrombosis, there was no pump failure. And it seems to be that the risk adverse event seems to be in the range of the other adverse event, in the range of what we know.
Now, the one thing we probably should mention too, besides the size, was that the trial really was uniquely constructed to enroll an all-comers population of advanced stage heart failure.
I think Rick, this is a crucial point, and thank you for mentioning it. This study is like changing the concept of how we perceive mechanical circulatory support. Until now, we look at it for 2 populations. One, bridge to transplant population, patient that get this device and eventually will need heart transplantation. And the other population is patient that is called destination therapy, patient that receive those devices in order to live a life on this device, and when this device will fail, something will happen. This is the end of what we can do. But this is an artificial separation of those patient population. What we need really to look at those devices is the next step of therapy to a specific patient. Whether this patient is a bridge to transplant or destination therapy, in an era that sometimes we wait for transplant for 2 years, it doesn't matter. What we need to look at all comer, and this is a different concept. All the patients that need device therapy, short or long, we're enrolled into this study as one, and we follow them according to the amount of time that they need to be of support. If they need a transplant and we will get off support after 6 months, wonderful. If they need to stay on support for 2 years for transplant, wonderful. If they need to stay on support because this is their destiny, also wonderful.
So we're not sure yet, but we may actually be at that precipice that you talked about in your editorial of disruptive innovation.
Yes, I think that we are, it's every time is a step. It's also a question what we want to achieve in the end. True. What is our goal?
Yeah,
and I think
that's like our cover story. Where are we going exactly with destination therapy?
Exactly, and I think that the goal is, the bar is becoming higher and higher, and this is wonderful. Today, in 2015, we can stand here and speak about people with end-stage heart failure that doesn't have an option for transplant because of donor shortage or because they're not candidate for transplant, and speak about a technology that can provide them quality of life, longevity, and to see their family and to have a full life. So now the goal is, okay, let's now not only speak about survival, let's make those pumps hemocompatible, compatible. The interface between the pump and the human body is the key here. And slowly, slowly we understand this is not good for the human body, let's take it off. This is what the technology is, the next step. However, every time we learn that there is something else we need to improve. So whenever we find something better, we want to achieve a higher goal.
So remember, this is in the JACC issue for December 15th, 2015. Look for Uriel et al. And his editorial comment on evolution of mechanical circulatory support. Are we at the precipice of a disruptive innovation? For CardioSource World News, I'm Executive Editor Rick McGuire.